Mrs. Ainhoa Arteta.
Thank you very much. Good afternoon, everybody, ladies and gentlemen, and friends. I normally used to sing and say stories singing, but this time I'm doing something that is unusual for me, but it's a great honor. Be the representative of Proyecto Hombre in Spain after I saw the work they do. So this manifesto represents the joint voice of more than 900 non-governmental organizations that operate in 82 countries and treat more than 700,000 drug-affected people every year. We all work led by the same dream to inherit a better world for future generations, deeply rooted in human rights and with more cohesive and healthy population. Reducing the world drug problem is crucial to achieving this mission. Unfortunately, even today, 5 out of 6 people with substance use disorders do not have access to treatment. UN offices, member states, and civil society are contributing with enormous effort to prevent and treat drug use disorders, but much remains to be done. Substance use disorders constitute a major public health and security problem worldwide. They are multifactorial disorders associated with a variety of conditions of individual vulnerability and social factors such as poverty, exposure to violence, and social exclusion. The recognized and globally accepted United Nations international standards for the treatment of drug use disorders recommended comprehensive and balanced approaches to drug demand reductions, suggesting evidence-based and human rights interventions such as outreach program and outpatient and residential treatments. Therapeutic communities are one of the most common and widely available approaches. Therapeutic communities are based on a model of learning communities where the objective from biopsychosocial approach is not only abstinence, but through a process of continuous and multidimensional change, transiting to a better functionality and quality of life in various levels such as physical and mental health, housing, employment, social participation, or caring for their environment. They also prevent the intergenerational transmission of addictive behaviors. Therapeutic communities are adapted to provide assistance to specific groups such as women, children, people with HIV and other diseases, mental disorders, offenders or ethnic minorities, with a workforce that combines high professionalism, vocation of service, and love for people. We invite the United Nations and the member states to promote treatments that address multiple areas of the persons, involving families and other social networks, with long-term programs and aftercare services to achieve effective integration into society. Likewise, we invite you to review the latest scientific results and models such as therapeutic communities, promoting collaborations in research. In some countries, therapeutic communities are not sufficiently available. those millions of addicted people could be prevented from receiving adequate treatment. At the same time, it is necessary to advance in the destigmatization, demonstrating to the international community that rehabilitation is possible as long as we provide the right help. Strengthening cooperation among governments, international organizations, NGOs, and civil society, and persisting in serving people as effectively as possible become the cornerstone to significantly reduce the world drug problem. We are totally committed to it. Behind these wonderful words and these papers are the faces of all the guys and the women and the children and the people that I've been able to see, and that are drug addicts or addicted to substances, and all the people that are helping them. And I can tell you by my own experience, they all are people that are trying to make a better world. Thank you so much.